So today's theme is anime. We'll get to why here at the end of the presentation, other than uh, a shout out to my son who, for some reason, really likes these movies. So I wanted to talk about a few recent studies that have been published in the literature that highlight a number of things I think we've addressed before, but always good to look at additional evidence. So the first study just came out from a group from the VA. This is the same group that did the study on long COVID cardiovascular effects that we talked about last week. This study used the same cohorts to look at mental health outcomes in people who had previously been diagnosed with acute COVID. So if you remember, this was a large cohort study of over 153,000 veterans who were diagnosed with COVID-19. And these were inpatients and outpatients, so across the spectrum of severity. And then they compared the experience of these patients with two matched cohorts, one contemporary control group, as you can see, over 5.6 million, and then a historical control cohort of 5.8 million, to look at the difference in symptoms and signs of mental health illness, and in particular looking at diagnoses and prescriptions for certain mental health conditions. And what you see in this study is that there is a significantly elevated risk of mental health problems in these veterans who had COVID-19, compared to contemporary and historical controls who didn't. So overall, across all of these conditions, you can see there's an elevated hazard ratio in those folks that had a diagnosis of COVID-19, between 1 and 2 for most of those conditions. So that's a significant absolute addition in terms of numbers of people. When you look at the overall hazard ratio for any mental health diagnosis, you can see it was almost 1.5 times. And for people to get a mental health related drug prescription was almost 2 times. And then if you look at the ratio by severity of disease, so people who were admitted to the hospital versus not admitted, you can see there is a strong correlation with severity as well, so that these COVID-19 cases that required hospital admission had a much higher hazard ratio for mental health diagnosis and drug prescription. You can see 4 to 6-fold compared to the 1 to 2-fold for all comers with COVID-19. And there seems to be a pretty good correlation in the Kaplan-Meier type curves that look at the incidence of these events over time. And so this provides more convincing evidence that long COVID is not just restricted to neurological and other physical manifestations, but there are manifestations in brain health and mental health problems requiring prescriptions and pharmaceutical management related to long COVID in these veterans. And that was from a month to a year out from infection. The second study, what really a meta-analysis of multiple studies, came out of the UK Health Security Agency, and it looked at the effect of vaccination against people who already had long COVID, or in preventing the development of long COVID. And so they took a number of literature databases to look for publications, and then weeded these down to 15 papers that had clinical trials that looked at the effect of vaccine in preventing long COVID or in mitigating the symptoms of long COVID, and found these are their major findings here, that people who had been vaccinated previously were less likely to develop symptoms of long COVID in the short, medium, and long term. Also, that people who were vaccinated were less likely to have many of the common symptoms associated with long COVID, as you can see listed there. And finally, that 3 of 4 studies that looked at vaccine in mitigating or altering symptoms of long COVID suggested that vaccination did seem to reduce the symptoms from long COVID. So this was people who had already had manifestations of long COVID who were then vaccinated. And again, 3 of 4 studies indicated that vaccination itself seemed to mitigate the effects of long COVID, although that was not universally seen. As noted, in some cases, symptoms actually got worse after vaccination, but for most people, they did appear to get better. Third study that is important, I think, to note, there's a lot of concern about patients who've had previous allergic reactions to vaccination with one of the COVID-19 vaccines, appropriately so. So we're always concerned about re-exposing individuals who've had an allergic reaction to an intervention, a drug or a vaccine. But this article that was published in JAMA Internal Medicine, again, another meta-analysis, looked at studies that had examined the experience of repeat vaccinations in folks who'd had initial allergic reactions. And so you can see, pooling all of these studies together, they were able to look at almost 1,400 individuals who'd had a known or suspected immediate allergic reaction after vaccination. And that's important because those type 1 hypersensitivity reactions, the histamine mediated reactions, are the most severe and the ones we worry about mostly in terms of causing anaphylaxis and the most significant risk of life-threatening or other major morbidity. And so these were the important ones to examine. And you can see among those 1,366, 78 had a severe, immediate, essentially an anaphylactic reaction in their first dose. And they looked at the experience of folks getting a second or repeat dose. And you can see that in almost all of these studies, there really was not a significant number of adverse allergic events associated with a repeat vaccination. The one study that seems to be an outlier is that study by Twang up top, where I think 4 of the 15 patients had an allergic reaction, 2 had a severe allergic reaction. But in the rest of the studies, you can see essentially those error bars indicate that there is no statistical significant difference from 0 or no increased risk of these allergic reactions after a second dose. You can see that of all of these allergic reactions, there were no deaths, all recovered, and there were no clear ways to predict or indicate who was going to have a more severe reaction after vaccination, looking at skin testing, graded dosing, pre-medication, and risk stratification. But ultimately, the takeaway was that for certainly people who did not have a severe anaphylactic reaction, a repeat dose of COVID vaccine appears to be safe. For those who had an initial anaphylactic reaction, the rate is still relatively low, as you can see, only 4 out of 78, but increased precautions are probably warranted for that small subgroup. And last, I wanted to talk about a study that was really an outbreak investigation that was published in MMWR recently, and this looked at an outbreak associated with a large convention in New York City. And this happened to be an anime convention in November. And if you remember, there was a lot of concern because this occurred right as Omicron was beginning to spread out from South Africa and Europe. And there were a couple of cases of Omicron associated with this convention. So looking at the outbreak associated with this convention, there's the epidemic curve on the left. And you can see that the convention took place between the 18th and 21st of November, but new diagnoses of cases extended all the way out until December 5th. Interestingly, when looking at risk factors for infection, there were a few things that popped up. First of all, in the blue arrow there, you can see that curiously, folks who'd received a primary vaccination series were more likely, or conversely, people who had a positive test result were more likely to have received a primary vaccination series compared to people who tested negative. Now, obviously, I don't think anybody thinks that vaccine creates a risk factor for developing COVID-19. However, there may be uh, some effect of people who had been vaccinated previously feeling more comfortable engaging in more risky behavior, which could have predisposed them to a more likely diagnosis of COVID-19. They're more likely to catch it, or as we've talked about in previous talks, and the paper that I presented from Australia indicated that people who have not received a primary series of vaccine are much less likely to seek out testing and thus to get tested and to confirm actual infection. And so there's probably multiple biases that go in place there. What is interesting, though, is that people who've been vaccinated, those who received a booster dose were much less likely to have a diagnosis of COVID-19. So that does follow what you would expect in terms of a pattern of negative tests had a much higher rate of boosting compared to positive tests. You can see just below the blue arrow there. But when you look at behavioral risk factors, I think this confirms what we've known about COVID-19 and how it's transmitted. The statistically significant behaviors that indicated risk for infection were not related to activities in the convention center, but were related to activities outside. So people who went to bars, people who went to nightclubs, people who dined indoors without their mask on. And you can see karaoke was the most significant risk factor. And so those behaviors where you are indoors in an enclosed, small environment with people without masks, often talking, yelling loudly, or singing, present the highest risk, and a much higher risk than being in this convention center, which, although it had 50,000 people, was in a large volume space with a high rate of air exchange and ventilation, and with a requirement that everybody wear a mask inside that environment. So even though you may think that it's that large exposure to multiple people, it's really the fact that those multiple people then break up into smaller groups and go into bars and restaurants and places where many fewer mitigation layers are in place that really presents the significant risk of infection. So again, nothing earth-shattering or unexpected there, but I think it just reinforces what we've known about the behavior of COVID-19 transmission. So that's all I have, and thanks. I'll turn it back to the meeting.